Namaskar, I am Dr. Himanshu Bavishi from Bavishi Fertility Institute, and I would like to talk to you about a subject called ovarian rejuvenation. So many patients are facing problem of what we call as poor ovarian reserve. The capacity of the ovary is reduced, the egg producing capacity of the ovary is reduced. Can we rejuvenate those ovaries? The answer is yes, we can try. We all know that with the advancing age, the ovaries become weaker and weaker and they produce less number and less quality of eggs. And we treat large number of women who are of advanced age. The effect of age is more after 35, even more after 38 and even faster after 40. So we always try to get the optimum outcome, optimum number of eggs out of the ovary, and for that one of the option we have is called ovarian rejuvenation, trying to increase the capacity of the ovary. Now, is it really possible to naturally increase the capacity of the ovaries? Yes, to some extent. An ideal lifestyle means good, healthy, balanced diet, maintaining your normal or near normal BMI, avoiding the substances which can negatively affect your health, correcting the nutritional deficiencies if at all you have, vitamins, micronutrients or whatever, and reducing the stress. If we can do this, then every system of the body rejuvenates, and with that ovary is not out of the body. So that is the best way to naturally rejuvenate your ovaries. The second question comes in our mind is, do we have medicines to actually rejuvenate the ovaries? Well, partially true. As I talked to you earlier, that if we have any deficiencies, then we can definitely correct the deficiencies. We can use micronutrients, antioxidants to improve the vitality of the body and in turn the vitality and functioning of the ovaries. We can also use what is called androgen type of drugs. Androgen is a male sex hormone, and there are receptors in the ovary which are responsive to that, which in turn can produce better response to the stimulation drugs which we give. But here again, it is not a sure shot. A few patients benefit with that. It takes 1 month to 3 months, 4 months time to actually become more effective. So you need to spend time. And particularly when we are talking about the poor ovarian reserve patients, time is very, very important. So if you are not willing to do treatment for whatever reason, it is not possible for you financially, mentally, physically or situation wise, then you can try these medicines for the time in between, and whatever benefits you may get, you can get. Otherwise, it is better to do a definitive line of treatment and go for the treatment earlier, because every passing time also reduces the ovarian capacity. The real effective treatment, the latest treatment is called PRP, platelet rich plasma injection in the ovaries. Now, why platelet rich plasma? We know that in our own body, the blood is the fastest developing cells, and those cells have very high proportion of what is called growth hormones, positive cytokines, etc. If we separate them and inject them directly into the ovaries, then they also provide growth factors and cytokines in the ovaries, which can stimulate the follicles which are there inside the ovaries to grow faster, grow more, and we may get a better response. So that is how the logic is. What we do is take the blood just as we take blood for any blood test, prepare it in the laboratory, isolate the platelets, enrich them and inject them into the ovary. So injecting inside the ovary is also not difficult. It's done by transvaginal sonography. Under the sonography guidance with a fine needle, you inject the preparation directly inside the ovary. It works locally, and we have found good results in many of the patients. Again, it is not a magic, it is not a panacea, it doesn't work great for every patient we treat, but it is definitely worth trying. Instead of platelets, we can also use stem cells, but it's little more complicated, little more expensive, but works the same way. So in short, real ovarian reserve problem is not 100% curable. So we don't say that if you have poor ovarian reserve, you do something and you will have excellent ovarian reserve. But what we are trying to do is that in the situation, try to improve the capacity of the ovary, get better result, and achieve our goal of having a baby with the help of these technologies. Before we conclude, I would like to say one more thing here, that in this situation we can use a very unique protocol which is called duo-stim or dual stimulation. What we do is that we stimulate the ovaries 2 times in the same menstrual cycle so that we get more number of eggs and we can expect better quality of embryos as well. To know more about duo-stim or dual stimulation, please watch my video on duo-stim. I hope it was useful to you. Thank you for watching. Namaskar.